You know that frustrating moment when you've just finished peeing, you zip up, and suddenly there's that one last annoying dribble that sneaks out? Yeah, not exactly a great way to start your day. And believe me, you're far from alone in this. I hear about this problem all the time. Hi, I'm Dr. Amelia, an Andrology Specialist. Today, we're going to talk about that all too common issue known as post-void dribble, why it happens, what it might be telling you about your body, and most importantly, what you can actually do to fix it. Let's start with what this is. Post-void dribble simply means a small amount of urine leaks out right after you think you finished urinating. You're done, you shake, zip up, and then, surprise, there it is. It can feel embarrassing or inconvenient, but it's actually extremely common. In fact, studies show anywhere between 5% and 50% of men experience it. And in my experience, that higher number is probably a lot closer to reality. So why does this happen? Well, there are a few main reasons, and understanding which one applies to you can make all the difference. One common reason is a narrowing in the urethra, also known as a stricture. Think of your urethra, the tube that carries urine from your bladder to the outside, as a small pipe. If part of that pipe gets narrower, some urine can get trapped behind it. So when your bladder pushes out urine, most of it comes through, but a little bit stays behind that narrowing. Then, when you move, walk, or shift position later, that leftover urine dribbles out. Men with strictures often notice other symptoms too, like a weak urine stream, needing to strain or push to pee, or a stream that sprays or splits in multiple directions. If that sounds familiar, it's important to get checked out by your urologist. There are simple tests that can identify a narrowing and treatment options that can make a huge difference. Now, another very common cause, and probably the one I see most often, is something called prostatic urethral trapping. Here's what that means. Your prostate is a small walnut-sized gland that sits right below your bladder and wraps around the urethra. As men age, the prostate often enlarges, a condition called benign prostatic hyperplasia, or BPH. This can make it harder for urine to flow through smoothly. When you finish urinating, your body uses two main sphincters, or valves, to control the flow. One is located at the bladder neck, and the other just below the prostate. As you pee, both open up. But if your prostate is enlarged and you haven't completely emptied the urine through that area, the bladder neck closes, trapping a small amount of urine behind it. Then, once that lower sphincter relaxes, that leftover bit leaks out, causing that post-pee surprise. It's frustrating, but it's also a clear sign that your prostate might be putting pressure where it shouldn't. And this isn't rare. BPH affects up to 80% of men over 70. It's one of those gradual changes that sneak up on you, starting with mild symptoms and slowly becoming more noticeable. The third possible cause is what we call idiopathic dribble, meaning it's not from a blockage or prostate enlargement, but rather from muscle weakness. Specifically, the muscles around your urethra. The bulbar cavernosus and ischial cavernosus are supposed to contract to push out the last bit of urine. Over time, or due to nerve or muscle issues, these muscles can weaken. When they don't do their job effectively, a little urine stays behind until gravity or movement pushes it out later. So now that we know the why, let's talk about the what you can do. If your symptoms sound like they might be caused by a stricture, weak flow, spraying, straining, or a stream that stops and starts, please don't just ignore it. See a urologist. It's important to rule out that kind of obstruction because it often needs medical treatment. If you suspect an enlarged prostate, pay attention to the other classic signs. You might be getting up multiple times at night to urinate, feeling like you can't fully empty your bladder, or needing to rush to the bathroom more often than you used to. There are plenty of effective treatments for BPH, ranging from simple medications to minimally invasive procedures that can improve your urination and your overall comfort. But what if your only symptom is that small dribble after you pee, and everything else seems fine? In that case, you're probably dealing with muscle dysfunction or weakness. And the good news is, you can often manage this at home. Here's where simple, consistent techniques can make a big difference. Technique number 1, the Bulbar urethral massage. Don't worry, this isn't as strange as it sounds. Right after you urinate, take 2 fingers and place them just behind the scrotum, about an inch back. Apply gentle upward pressure and move your fingers forward toward the base of your penis. What you're doing here is physically pushing out the last little bit of trapped urine from the urethra. Do this once or twice immediately after peeing, and you'll often find that annoying dribble disappears almost entirely. You can also gently shake or squeeze the base of your penis after urination. Nothing excessive, just enough to help clear the last drops. It's simple, discreet, and surprisingly effective. Technique number 2, strengthen your pelvic floor muscles. Yes, men have pelvic floor muscles too, and they play a big role in controlling urination and sexual function. These are the same muscles that help you stop urine midstream, but don't practice while peeing. Instead, identify those muscles by pretending you're trying to lift your penis slightly without touching it. That subtle tightening you feel, that's your pelvic floor working. Start by tightening those muscles for 5 seconds, then relax for 5 seconds. Repeat 10 times. Try to do 3 sets per day, morning, afternoon, and evening. Over a few weeks, those muscles get stronger, and you'll notice better control and less post-void leakage. It's important to emphasize the relaxation part too. If you keep these muscles constantly tight without learning to release them, you can actually make things worse, causing pelvic tension or even pain. So always balance squeeze and release. Now, a quick note. If you ever experience pelvic pain, pain during ejaculation, or persistent testicular discomfort, stop doing these exercises and check in with the urologist or pelvic floor therapist first. Sometimes pain can indicate that there's more going on beneath the surface, and you'll need a personalized plan. For men with BPH or other prostate issues, pelvic floor strengthening can still help. It supports bladder control and can improve the force of urination even if your prostate remains slightly enlarged. Combined with medical treatment, it gives you the best results long term. Some men also find it helpful to make small lifestyle adjustments that support better urinary function overall. Simple things like reducing caffeine or alcohol in the evening, staying well hydrated during the day, and not holding it in for long periods can all make a noticeable difference. When your bladder stays healthy, your muscles don't have to work as hard. Let's not overlook another major factor: age-related muscle decline. Just like the muscles in your arms and legs, your pelvic muscles can weaken with age. But unlike a gym workout, you can strengthen these muscles quietly without anyone noticing. Even a few minutes a day can translate into real, tangible control. And remember, this issue, post-void dribble, doesn't mean you're unhealthy, unclean, or doing something wrong. It's simply a mechanical issue. It's your body saying, hey, something needs a bit of maintenance. And like any good system, once you tune it up, it performs better. If there's one key takeaway I want you to leave with today, it's this. You can absolutely fix this problem, whether it's by addressing an enlarged prostate, strengthening your pelvic floor, or using a simple massage technique. There are real, practical solutions that work. So if you've been quietly dealing with that little post-pee surprise and just hoping it would stop one day, it's time to take action. Try the techniques we discussed, stay consistent, and if symptoms persist or you notice other changes in your urinary pattern, get checked by a specialist. You'll be glad you did. Because when you regain control, you regain confidence. And that confidence touches every part of your life. I'm Dr. Amelia, and I hope this talk helped you understand your body just a little bit better. Take care of yourself, stay proactive, and always remember, you're worth the effort.